My wonderful banter.
Wonderful banter is what we start with when we go live on the
Always.
Auburn Medical Group live on YouTube.
Yeah, where are we? Wait,
Which format? Which was it? MySpace? I'm trying to remember.
MySpace. Wow.
Yeah,
Impressive.
How about that? Did you know that people
Yeah.
can call in to our show and talk to us
I did
with
know
telephone
that.
numbers?
Yes.
What a telephone number?
Yeah, just use your phone.
Just use your phone,
That's all
and
you need.
it's in the description, the number to call. So hopefully we'll get a call. I'm looking at the phone right now. Look at all the calls coming in.
We're going to have to screen those.
Yeah, well, be good. Just
That's right.
we want it to be advertiser friendly.
Call screener.
Yeah.
That's right.
And we have super chat
And super chat. You can always do that.
and regular chat. Oh, and look who joined
Regular
us.
chat.
I was going to say Francis, but I realized we have a Francis in the office now. We can't use that name anymore.
A new name for
Patty?
pull apart Patty.
Did you know Pat?
Let us know.
Did you know the same pull apart Patty I knew?
No.
Mr. Fonda's class?
Oh, I don't think there was a pull apart Patty, Mr.
Oh,
Fonda.
all right.
I had Mr. Fonda.
All right.
Anyways.
But this one came with the name Francis, I think. And now that we have Francis working here, Dr. Patman,
Yes.
as we discussed on our last video.
Try to bring up everything.
So go ahead and start writing in comments or calling in at any moment as we talk about Dr. Gawayne's new job.
Did you know that Bianca used MySpace? Or she never used MySpace. She used Bebo before Facebook. I've never heard of
Bebo.
I've never even heard of that one.
Yeah, I don't
Is
even-
that a-
Bianca? I don't even know that one.
Is that a UK thing? maybe?
And for those of you who are new to our show, Bianca is one of our regular viewers. She gets 5 stars.
Yes.
Yes, because
We appreciate her
She is
interactions.
so regular in being here, and
Joe is a good name. Well, the thing
Joe?
is, Joe. It can't be Joe because it's kind of it
Yeah,
needs
Joe
to be
works.
a gender.
Joe's
could be.
gender neutral.
Oh, I guess that could be.
Yeah.
She spelled out Joe. That's I guess J-O.
J-O or J-O-E, you don't know.
Joe.
Just like
Jolyn.
You don't know how we spell
Joellen,
Francis?
Joe.
there's only one way to spell Francis. No, there's 2.
No, there's 2.
E-S or I-S. Yeah, there we go.
Anyways, Joe. It's Joe.
Yep.
Bianca, you win.
And we got nice comments on our video last week.
We did.
I
What-
did read those comments and responded to them.
I don't even remember what last week was about. It's been a long week.
We were answering questions.
That's right.
And
Yeah,
at the
yeah,
very
that's right.
end, the PA who prescribes opiates
Oh yeah. He was
wrote
asking
the
us
comment.
if
And
we.
so, yeah.
Yeah.
I forgot his name. I'm sorry. I forgot where you working. Well, I think he said where he was. And I forgot your name too. I think it was.
Pittsburgh. I
I
believe.
think it was a he. Were you a he?
Yes, I believe it was
If you're-
a male name.
Well, in Pittsburgh, he'd be able to watch us right now
Hey,
because
yeah.
it's after hours in Pittsburgh.
Yeah. So
Yeah. Dr. Gawayne has a new job.
I do. Yeah.
I'm not quite sure how to say it because if you say a new job, it sounds like you don't still have your
I have my old job.
current job, but you do.
I added on a job.
An additional job.
And I have an additional
It
job.
is new, but it's additional. It's
Right.
not a replacement.
Right.
He's working twice as hard.
Administrative job.
Administrative job.
Yeah.
What is your administrative job?
Yeah. So through
What's your
our IPA, our Independent Physician Association, which is about, what do we have, over 500 physicians in our group. I am one of the medical directors and specifically medical director of Service Excellence, along with another doctor, Dr. Walker. So service excellence. I don't like the term service excellence. So my first order is going to be to try to change that.
To try to change service excellence?
Change the name of my position. Service excellence. I like the patient experience.
I did
don't
that.
know.
That was me. Sorry.
I just feel that
I'm playing over here.
as physicians,
We should all be excellent.
yeah, we should. But you hear about all these test scores and Press Ganey and survey scores and stuff like that, and that's associated with service excellence. So it kind of leaves a bad taste in our mouth, just that we're being graded. So focusing more on the patient experience and providing care that provides the patient with the best experience in your office. That's what I'm all for.
So it's not smile school.
What? It's not? That's all I do, just smile.
Just sit there and smile.
And,
I am the vice president
and
of
nod.
Smiles.
And nod.
That's what you
That
do
lets
in the
people know you're listening,
Yeah.
right?
Interesting thing. Even though he's the medical director of Service Excellence, I am still the chairman of the Service Excellence Physician Advisory.
You're right. The board.
Committee?
Committee.
Commission?
It's a committee. Yeah.
Is it a committee?
Yeah.
Service Excellence
You were there before me.
Physician Advisory Commission, Committee,
Pretty sure it's committee.
Cabinet.
You're a cap.
I'm a cabinet member.
Pretty sure.
The
Congrats. Thank you.
council.
Council. Council? Is it a council?
Physician Advisory Council. Yes, it is. Yeah, it is. Yes, I know what I'm a part
You're
of.
council.
Yes, I know what I'm.
Because you're the
I know what I'm the chair of.
a chair.
The chairperson
of
of.
the yeah.
Which we haven't had a meeting together yet. And you think they know we're related because we have the same last name. And we always sit at the same type of
Laura
meetings.
Lee Magnetism. I don't think that's a magnetism, but Laura Lee says, I've watched all your videos but never say anything. Now you have.
Wow.
All of them. That's a lot
Long
of
time
videos.
viewer, first time caller.
You could be a first time caller
You too
with the
could be a
number.
first time caller. In the description. What if there's a bunch of people dialing the number in the description and I got one of the numbers wrong? And
Oh, that'd be bad. Somebody somewhere is getting all these
yeah,
things.
let us know if that's what's going
Somebody
on.
else is answering.
Because there's no calls coming through, people. That's okay. We'll respond to the text questions about his additional position, not new.
Additional,
position, but-
not new.
Yeah,
It's
not new.
a new additional. Because it's
Yeah.
new.
Yeah.
But
So-
I'm not leaving my current
I
job.
was going to say, how much time does it take?
They say about 20 hours a month. So that's
So
about
really, you're
5 hours a week.
You're not even missing a full day a week.
Yeah, not even a full day.
Yeah. So he's still seeing his patients. Those of you who are Dr. Gawayne patients, know.
How do
Oh, do
we-
you want me to read this instead of?
Make sure that somebody
Whoa!
is
Whoa! We're getting spammed.
Brandon.
Brandon, easy.
Yeah.
We know you're there.
Yeah.
Wow. We appreciate your zeal.
Yes. Let's
Okay.
put it that way.
So what happened either before or after the random?
Somebody says, why are doctors so hard to come by for rare diseases? I got diagnosed.
Doctors for rare diseases. Interesting. You know, people have the impression
It's hard.
that doctors for rare diseases are hard, but yet at the same time, we're saying too many people are going into specialties and we have a demand for primary care. Those two things that we're seeing, or at least seem to be seeing, are they compatible?
Laura Lie. Okay.
Is that
Getting her
possible?
name right.
That we don't have enough specialists and we don't have enough primary care at the
It's
same
probably
time?
possible.
Is there a physician shortage, Dr. Gawayne?
Oh, absolutely. Definitely in the primary care field. But why is it hard to find a doctor for a rare disease? Because there are so many rare diseases out there. Even specialists don't always treat certain rare diseases. So it can sometimes just be hard to find.
Kind of like our experience where we call up the specialist and say, "Oh no, I'm not.
Yeah.
I'm not the person for that. You need a subspecialist."
Right. Yeah. So a specialist within a specialist field,
Yeah.
and we're kind of in a an area where we have access to some bigger places, but you got to drive. So we're 30 minutes from Sacramento. So we
Yeah.
have UC Davis there. We're a couple hours from UCSF. So usually these are you're going to find specialists for these sorts of things at bigger university centers. And if you're in a suburban or more rural population, you're not going to find it. I mean, there just aren't enough of those rare diseases for people to come to that doctor in that area. So typically you need to just go to some place where they're going to see more of that. And sometimes it's only one place in the whole country. So some people can be that specialized in a certain disease. So.
Yeah, I'd want to emphasize what you had said about there are so many unique diseases. That needs to be said again.
Yeah.
There are so many things that are just identified in a small number of patients in so many different specialties that, it's hard to have all those super specialized people. And they're all over the country too.
Yeah.
Like you said.
Yeah, depending on what the disease is. I mean,
you might want to go to Mayo or New York or...
I mean, I have some patients who have taught me things about their really rare disease because I heard it maybe once in medical school, and it was one of those where they'll say, you'll probably never see this.
You'll probably never see this.
And a lot of them you probably are never going to see because it's so rare.
All the students come in and take a look at it.
Yeah, that's right. So when you do see it, everybody gets to see it.
I've seen it.
Yeah.
Never see it again, but I've seen it. So this job you're doing when you go to it, what is it that you do?
So as a medical director, it is my and another physician, we're kind of both directing. She's kind of overseeing the specialist side of it. I see the primary care side of it. But our job is to essentially make sure that the physicians in our IPA, our association, are providing good service, that they are making sure that patients are having the best experience, that they are having good customer service.
When you say your association, do you mean Auburn Medical Group?
Actually, a bigger association, Sutter Independent Physicians, which I said is about a little over 500
So you
physicians.
work for Sutter?
I don't, actually.
Explain.
This guy doesn't make sense.
Because it's called Sutter Independent Physicians. So Sutter is the,
Oh,
the
you
big...
explain. You're on the board.
Okay. Shh. Sutter is the big player when it comes to health networks in the Sacramento area. There's Kaiser, and there's Sutter, and there's Dignity, and there's UC Davis. So these are the big boys. They're the ones with the big tertiary care medical centers and lots of associated clinics and labs and imaging and huge medical bodies in this area. Well, our Independent Physician Association kind of has a contract with one of them, to the point that we actually identify with them by having the same name, Sutter, so that people know that's the one that we work with, so that their HMO is the one that we get patients from. And when we refer to specialists or to hospitals or to imaging, because it's an HMO through the IPA, not just, but a lot of the patients who have this insurance through Sutter Independent Physicians, it's an HMO insurance. Their insurance, of course, uses their own facilities because it's Sutter that has the insurance plan. And so we contract with them to have our patients in our independent practice get paid through them. And, since they own the lab and the imaging,
Right.
they pay for the patients to go to that lab and image. It's not all we use. We work with UC Davis. We work with Dignity, with patients that have non-HMO insurance. But that's the relationship. So even though Sutter's in the name, it's not owned by Sutter, but just a very close relationship working with, and lots of contracts between.
Right.
Is that a good way to describe it?
Yeah.
So, yeah, we could just as easily be called Sacramento Independent Physicians, or some independent physicians, or super independent physicians.
It'd be the same acronym.
And it'd be the same acronym, and it'd be the same group. And
Sober. Independent. No, that wouldn't work. There are some in our group.
That's to differentiate us from the other ones in
that
town?
doesn't really apply.
Sober Independent Physicians.
Sober Independent.
I'm going to bring that up at the board
There you
meeting.
go. Bring that one
Let's
up.
change our name
Yeah.
to Sober Independent Physicians. That sounds like we're no
yeah.
fun, though, too.
So I don't know if
Sober.
you're able to put people on timeout anymore, or on that.
Oh, does somebody need to be put in timeout?
Yeah, just. So,
Where-
anyways,
Where's that done? I don't think I do it here.
no cure. D. Thompson has.
I can do it, though.
I think it was.
if you want me to.
Potts
Do you want me
puffy
to?
tumor.
Potts puffy tumor?
Yeah, it may be going on, but
Maybe.
yeah, I remember hearing about that one. Potts puffy tumor. Yeah.
Well, while you entertain and talk
Well,
about that, I will look for a phone call and work on the whole timeout thing.
Anyways, yeah. Sorry, folks, that
I-
somebody is being a little annoying in the comments. I apologize. We're working on that.
We need to do something, huh?
Yeah.
right.
So let's see. Oh,
You wait till Dad gets home.
Do you ever get ill, and do you prescribe for each other? Let me tell you about
Let's
me
talk
getting
about
ill.
that. Let's talk about
If you
that.
remember, about 4 weeks ago, we didn't have a show
We didn't have a show.
because
We didn't.
I had pneumonia.
Yeah.
Yeah. And I was out for most of that week. But so I came in and I saw one of our providers, Frances, actually. And,
Dr. Patman.
And she listened to my lungs, and I had pneumonia, and she prescribed for me. So we do, on occasion, see each other. And
You did do
prescribe each
my neck procedure
I did
in the
do
high
that.
school classroom, which is on video.
other. Yes.
But for the most part,
It's
we really
documented.
make an effort not to practice on each
Yeah.
other and each other's families.
We try not to.
I wouldn't say it's 100%, but certainly if it's anything serious, we are very quick to have somebody else. We certainly absolutely do not prescribe controlled substances.
Oh, no way.
In fact, I don't even know if we prescribe anything for each other, maybe for each other's families until you get into your primary care doctor, something like that.
Yeah.
Yeah.
Yeah, I don't
And
think
we've
I-
both given our kids stitches and
Yep. In the office on a weekend.
yeah, that's right. Come in. Yep.
Call up
You call up a nurse.
the nurse after coming in.
Yeah,
Our nurses are wonderful.
we have done that, and but the board, state of California, the Board of Medicine discourages providing health care to family members
Right.
and close friends. And we take that seriously. And outside of these, few exceptional little, not real important things, and never controlled substances, we, view ourselves, if anything, as helping out with a primary care doctor who is somebody outside of our office, and not actually doing the care for family members or,
Yep.
For those who don't know, we're related.
So that would be.
And you're not my son.
No.
Okay, I'm still
He
looking.
kind of takes offense. Well, I think it's calmed down, so maybe
think it's calmed
we
down?
just called him out and that works.
Because
But anyways, somebody asked if you prescribe for weed. That's what it says. Do you prescribe
For weed?
For weed.
for weed, do you prescribe for weed?
No, only 3.
Ow. It made me laugh in my chest. hurt.
What just happened?
Okay, weed. How do we handle that?
Weed is the best drug. Works as well as morphine. Says Brio.
No.
Works differently.
For some people, maybe, but yeah.
I would probably
It's got
prefer
some
weed over
analgesic
morphine.
benefits. What?
I said I'd probably prefer weed over, not personally,
Not smoked.
but no.
Yeah. That one thing is the delivery.
Smoking stuff's not good for you.
It doesn't have the greatest delivery because we don't prescribe anything to smoke or recommend. Orally it's a way to deliver it without having all the problems associated with smoking, but then you have a problem with absorption, especially depending on what the patient has eaten.
Yep.
So you can have a great response, and then another time you can have a horrible response, depending on what's on their stomach, or it takes a half hour or more for it to take effect. And I'm trying to, I say these things in general because I don't know the specifics. It's better if you have fat in your stomach because it's fat soluble.
Oh, I don't know. I'd have to look that up again.
And so if you have a fatty meal, a little
Yeah.
bit of fatty food,
I
it'll be
think it's,
absorbed quicker than if
yeah.
you have non-fatty food.
Yeah,
Absorbed
I think it is
quicker
fatty.
if you don't have
I
food.
think so because it's an oil-based resin.
Not
Not
clear on
resin,
that because
oil-based.
we really don't have a whole lot of application
Yeah,
for
because
it.
we don't prescribe it. I guess that was the main
But-
question.
But
We don't.
we do talk to
actually
patients.
have talked to patients about
Yeah,
it. Since we're in California, it is legal
Yeah.
to do it recreationally here.
Yeah.
And truly, some of my patients will start using it when we're talking about weed. I should clarify. I don't recommend weed. I usually recommend CBD or like CBD oil because that has the analgesic properties without the psychoactive effects. So it's the THC that has the psychoactive effects on the brain.
Euphoria.
Yeah. So that we want to try to avoid. That's the one that has all the problems. CBD is actually an emerging field of research in medicine that they're actually doing a lot of research for pain.
You and I both have attended the talks where they talk about how the entourage effect of having the CBDs together with the THC
yeah.
actually having
Right.
the weed rather than some processed oil seems to get a really good response in patients. And then the argument is always made by the people who are promoting the use of it. You have side effects from all these chemicals that you prescribe patients.
Right.
What's so bad at the side effect is that they feel good for once.
Right. Right.
It's a good argument. But as far as the benefits, it's a little out of control right now. The number of things and the variety of things that cannabinoid is good for. If you ask anyone, you can see, you can pretty much have somebody tell you that it's good for absolutely anything.
Yep.
And you can get studies that suggest or that try to look at a lot of things. Some of them, it actually has good data.
Right.
And so the things that have good data are the seizure control in children. I don't know if it's a particular type of seizure or just seizures in general.
Yeah, it's the ones
And
with
is
the
it
really
children,
bad one, like
or is it anybody?
Gestalt syndrome and stuff like that. The studies were done in children.
Okay. Glaucoma.
Yeah.
We know it's good for that.
Good for glaucoma.
Some people do get a nice calming effect from it. Those who don't happen to have the acute panic reaction to it, which is the exact opposite.
Yeah, the weird thing is if you look at the side effects or the effects that can come from weed and marijuana, sometimes people say those are the things that you're treating. So like you can get a cyclic vomiting syndrome, but people say it treats nausea.
It does.
You can get
Treats Anorexia.
anxiety, but it can give you anxiety. It's kind of weird. Yeah.
Even though you say that as if it's suspect, or it almost sounds like you don't believe it. It's true though. It does do both sides.
Right.
Of those things you mentioned.
It is tough. And there are.
I'm sorry. I put my hand on your chair.
I'm shying away here. So there are some things that some side effects that we know that it has. So it does have a kind of dumbing down effect on the brain, and it should never be used in developing minds under age 25, because your brain is still developing, and it can essentially just retard or stop that process of development. So don't use it. Kids should never use it, and you should never use it under age 25.
Okay.
What other problems? Oh, and it can have the cyclic vomiting syndrome. So if you do start getting vomiting syndrome, you need to stop it. Yeah. It can induce psychosis, where you literally go crazy from it.
Not permanent.
It's not permanent, so you stop it and it goes away, but you probably shouldn't do it again if that happens.
We do find that it does have some association with people having, like you said, the psychotic episodes. There's been some data suggests that it's associated with people being diagnosed with schizophrenia or having their first psychotic break. Now, did it cause schizophrenia in those cases? Probably not. It probably just kind of triggered something that was under the surface and ready to go. And people who know those schizophrenics probably knew that there was something going on anyway that, was a little concerning as far as the symptoms of schizophrenia. Right. What do they call them? Soft symptoms, or what do they call those symptoms? Like the not the active
the
things,
negative,
but negative symptoms. Yeah, rather than the positive symptoms.
Right.
Which would be like the blunted affect and not
shying away.
Not interacting. Almost like autism type of description. Yeah. Before they have their more colorful hallucinations or paranoid delusions, things like that. Yeah. I'm sure you got a whole lot of comments. I was going to say something else about delivery.
Oh, sure.
We talked about smoking it. We talked about the oil, but there's also vaping the oil.
Yeah.
Which allows for very quick delivery, and very measurable delivery, right to where you want it without having to inhale something that's smoke.
Right.
And so if it is to be used for medical purpose, that's probably a pretty good way to deliver it. Again, I'd emphasize coming from a known medical grade source, and we really don't have that right now. We have a lot of people who claim to be that.
There's a problem,
but we don't have FDA control over this thing. And you can get anything, and you can get really, really strong stuff, or you can get stuff with.
Should we tell them about
our lady?
Yeah.
Yeah, and who else had one like that?
So we had a lady come in who had we had to get it out of her, but she was taking some weed, but she was having some really weird symptoms. I don't even remember what her symptoms were, but we did a U-Tox, and it turns out
urine tox screen.
Yeah, the weed was laced with
ecstasy.
Ecstasy, that's what it was. Yeah, I was trying to remember.
Yeah,
ecstasy.
And
you don't know what you're getting. I mean,
the patients tell us they're getting it from dispensaries, and they're very reliable, and they trust them, and yet we're still seeing this happen. So we are not totally jumping into the recommendation of CBD or marijuana, either one.
Right. Not quite there. Just need some better regulation.
I don't tell patients not to use it when they're getting good effect from it and they have a source that seems to be reliable and safe. Seems. Again, we don't have any regulation over. There is regulation actually in California. They are supposed to be going through some testing to make sure there's not pesticides or heavy metals in it.
Right.
But
as far as dose
this is the Wild West.
It is. Yeah, literally.
Yeah, it really is. So
that's on the West Coast.
So are we getting the pro CBD people just going crazy?
No, actually, not really.
Blowing up.
People just saying it helps them with their certain
okay. We have some accounts of people watching that are getting benefit from using it.
Yeah.
Okay.
Menstrual cramps.
Don't
know that from personal experience.
Okay. All right.
But hey, I can see how it would help with that. Yeah. I guess.
All right.
And you wouldn't be pregnant if you're having menstrual cramps. So that's good. You shouldn't take it while you're pregnant.
So if this person using it for the menstrual cramps gets relief, they're over 25, they're taking it in a way they're not smoking, whatever, and they've never had really bad side effects from it, would you tell them to stop?
No, I don't think I would.
I wouldn't either.
Yeah.
No.
Yeah, probably make sure that it's a reliable source. That's the biggest thing.
Yeah. Yeah. They're not going to get something different the next week. And,
Right.
Yeah. So I agree with that. Yeah.
Yeah.
All right. Since we pretty much talked about your job.
Not that much, but a little.
Oh yeah. What else do you want to say about your job?
I don't know. What else we want to say? What else can I say? What do? I told you what I do. I work with
You go to meetings to help.
meetings. So I have a team. There's a group of coaches, actually, is what their official
Coach
term.
Steve.
Coach Steve is one of those of coaches that help practices improve their customer service. Essentially, they teach them ways, work with them closely, and we also get these surveys. So right now we're really working on making sure everybody in our group gets the surveys done. Like you get these little iPads and have patients fill them out after their visit, because we're just trying to get the information of which practices need help, and we can provide that help. So
Yeah.
I'm sure some of you have had great doctors where you would mark, all fives on a scale of 5
or 10.
whatever your scale is. The highest box.
Make sure you scroll down to
Yeah,
know what the highest
you got a
box
5.
is.
Oh.
Yeah.
But I'm sure you've had other doctors where you would not give them the highest score. So
Yeah.
we want to try to work with those doctors to
Yeah, and
improve
you can write
those
little
scores.
comments on them. So
Yeah.
this allows the doctors
We
to
do this,
see
in
how they're
our
doing.
office.
Yeah, we do it in our
Yeah.
office. It allows us to see what the thing is that we need to improve upon so that we can improve on it to give better experience to our patients so that our practice is better.
Right.
We're trying to be good. We're trying to do a good job, and
We aim to have
Yeah.
the best patient experience.
we do. We actually do.
Yeah.
And you'll hear us sometimes complain about less than stellar experiences.
Right.
That's the
It
fun
happens.
of seeing behind the the white lab coat here and see
Yep.
what's really going on. But really, we do want the best experience for the patients, and those few exceptions that we sometimes talked about are very entertaining, but they are very
They're
much
the exceptions. For sure.
exceptions.
Yep.
We have a very good, smooth, good patient experience, good doctor experience going on for
Which
the most
is why
part.
I will still retain my old job
Yes, he still has his job.
even
though he has
as
a new job.
family physician, because that is still where I find my joy and where
Yeah.
I really feel I
Yeah.
can do the most good. But with this, I can kind of expand my reach and hopefully
It's neat to
affect-
do it. It's,
affect
meet
more.
other people in the region. And
Yep.
it's fun to have those positions.
Yeah.
Okay.
So there you go.
And anyone last minute comments, questions, or
No,
phone
no.
calls? Phone calls. I'm looking.
Get in
No,
before.
no phone calls.
Oh man.
Yeah, we'll keep it up though.
Yep.
Nothing.
That's it. So
Okay.
we should probably thank some people.
Oh yeah, absolutely. Yeah. Well, I want to thank Lindsay Antwine, who actually commented last week.
Yeah.
Wait, was she here live?
She was, yeah.
I think she did a
commented
yeah,
live.
Good
last
job,
week.
Lindsay. You got in.
Got one of those.
Yeah.
And I'd like to thank Boo Boo Kitty.
Boo
Thanks
Boo.
for supporting the
Absolutely.
blog on Patreon.
Yeah.
You make it happen.
All right. Oh yeah, and you did write about this in your
I
blog.
did, yeah. So if you
tell
want to go
people
check
about
out
the Dr. Green Knight blog.
Yeah. Go to the Dr. Green Knight blog. All sorts of stuff. The most recent one was about this new job and
Yeah.
kind of what my vision is for it and how to help people. So
Yeah. And you can comment on Dr. Green Knight too,
yes, you can
and subscribe.
do that.
All right. Thanks,
Yep.
Dr. Wayne. All right. Until next time.
Dr. Gawayne Bond.
And Dr. Mark Vaughn telling you to stay in good health.